slides are great for study information, but we're going to kind of blaze through the PowerPoint. So the facts are there, all the testable information. So starting out with bovine respiratory diseases, we're going to spend a lot of time talking about bovine respiratory disease complex, which actually encompasses most of the pathogens. And then that BRDC is going to serve as a model for when we move to other species to talk about their respiratory disease complexes. The pathogens are different, but the pathogenesis will be very similar to different species. Okay, so respiratory disease complex, bovines is also known as shipping fever. I've heard of it. This is pretty much the #1 disease of cattle. It's huge economic importance because it hits animals when they're shipping between facilities and they're getting it reduces yield. So this is a multifactorial disease. This is the copy paste that applies to other species. So the first thing that you need to have is some sort of thing that's reducing your local respiratory immunity. So that's things like stress, weaning, co-infections with other pathogens, transport, crowding, all the stressful events. So that's kind of the primary or initiating event. And then concurrent viral infection. So this further lowers your respiratory immunity. So you're stressed out, lowers immunity enough for you to get a virus, which lowers your respiratory immunity even more. And then you get these secondary opportunistic bacterial infections. So kind of like we mentioned yesterday, the bacteria cause a lot of the pathology and are often directly responsible for death. But in terms of the pathogenesis, these two top things are going to be more important in thinking about prevention and strategies to deal with this. So how many of these viruses can we vaccinate for or eliminate from the herd? Because these opportunistic bacteria are in the mouth. You're not going to get rid of them. They're part of your common flora. So we really want to focus on these top two. So we're going to go first into the major viral pathogens. But first, we're going to do kind of general rules of thumb about herpes. So alpha herpes, the rules of thumb are these are very necrotizing infections, and they're usually directed at epithelial surfaces. So necrosis of an epithelium causes an ulcer, right? Just like that fibro necrotic membrane, that's an ulcerative process. Necrosis of the epithelium leaves a denuded area. This is a DNA virus, so you will see intranuclear inclusions because it is using the host DNA replication machinery. Ubiquitous subclinical infections. So think of cold sore infections. Everybody has them. Almost 100% of the population it would be because they're so contagious and so easy to catch. They also undergo latency, usually in nervous tissue, and then they will reactivate with stress. So this is a very common cause of illness and outbreaks with stress. Some examples, we're going to talk about a couple of these, but the human cold sore is really the one that sticks in my mind because everybody knows what that is. Sorry, but you don't have herpes. Need to break it to you. So kind of remember those rules of thumb when we're talking about the specific pathogens. PHV1 is about herpes, so it's going to cause ulceration of mucosal surfaces, so nose, nasal cavity, upper airway. Also responsible for other syndromes that we're not going to get into, some abortion, keratoconjunctivitis. Again, undergoes latency, and similar to these other bacteria or these other viruses, this will predispose to bacterial infection. Okay, so here's what that looks like. This is a cross section of a nasal cavity. So here's nasal, here's nasopharynx, there's oral cavity, right here, there's teeth, we've cut the head. This on midline. And all of this white exudate, this is the beginning of that fibrinonecrotic membrane that's exuding onto this ulcerated surface right here. Same thing in the trachea. So here is a little bit of what might be tracheal mucosa peeking through these tiny little pink spots. And all this white food is fibrinonecrotic membrane. So that's all fibrin and dead cells and junk. Okay, PRSV, so this is a paramyxovirus. Rules of paramyxovirus. So these guys usually infect multiple subtypes. If you think of canine distemper, that's kind of my prototype. I'd say measles, but nobody knows what measles is anymore. You don't get it, except in California, we don't vaccine people. We have measles pockets here. Mumps. No outbreaks. Not here, but like Oregon. Yeah, Oregon gives me kind of yeah, so canine distemper. Kind of the prototype. So if you think of where canine distemper hits, nervous system, crusty nose, respiratory, and immune cells. So it has kind of a, not quite a pan-tropism, but a multiple tropism for multiple cell types, often including leukocytes. So these often involve a component of immune, generalized immune suppression, not just local respiratory immune suppression. These guys don't obey the rules with inclusion, so they can do intranuclear or intracytoplasmic, whatever they want. They often cause syncytia, which is fusion of multiple cells together to create these abnormal multinucleated extra large cells. So BRSV is pretty common in North America. I don't need to read this. You guys can read all that. The info is there. Bye. All right, so here's what BRSV looks like. If you see it alone, so you can see these viruses alone, but it's much more common to have them superimposed with a secondary bacterial infection. So mostly what you're going to see is, we talked about yesterday, the bacterial bronchopneumonia, the cranioventral pattern, the fibrinosuppurative, nasty bacterial stuff. If you see it alone, you can see just kind of a cranioventral consolidation. So you can see there's kind of this line of demarcation here. But it doesn't look like those lungs yesterday with the bacterial pneumonia. It looks a little dark. It's probably a little bit firm, and you have to be able to know. I have to be able with my eyes. But it's still a cranioventral pattern, so we're still thinking some sort of aerogenous or inhalation. Influenza virus 3. I don't have any general rules for PI3. You just have to run them. It's also a paramyxovirus, but generally a little more mild infection. So a lot of animals are infected, but disease from this alone is rare. Its primary significance is that it's going to predispose you to secondary pneumonia. Okay, some other viruses that we do see that are part of the complex. BVDV, we're not going to talk about, because you guys probably get hit over the head with that. Every system class. Coronavirus, similar to our recently acquired respiratory coronavirus, can cause respiratory disease. In cattle, coronaviruses are usually enteric outbreaks, but you can see both forms in a single outbreak. Okay, so now we're going to talk a little bit about the bacterial opportunists. So again, general principles. I know this is like heavy repeat today, but this is super important. Bacteria are upper respiratory flora. So they're isolated from healthy animals. And the lung is normally exposed to low numbers of this just from the action of breathing. The way these cause pneumonia is with lowering of your respiratory defenses. So that's by stress, crowding, weaning, and then viral infections that we just talked about. Because the bacteria are not primary pathogens, they're commensals. The outbreaks are often polymicrobial. So if you culture these lungs, you'll get a mixed bag of like intermediate pathogenicity stuff. You'll isolate potentially these common pathogens, but there's a lot of stuff in there. And then the host response to bacteria exacerbates disease. So these guys usually produce a pretty florid immune response once they're actually in the lungs. So lots of pus, lots of necrosis, lots of fibrin. So they're very destructive, and most of them are gram negatives. So sepsis is an option. All right, so hemolytica, it's called hemolytica because it lyses your blood cells, your phemocytes. So this is what that looks like in bacterial culture. We actually grow the agar that contains sheep's blood, and you can barely see the bacterial colonies, But what's more prominent is you can see this little halo around them and this clearing in the blood. So they're actually lysing and eating blood cells. Again, synergy with the respiratory viruses, especially herpes. Those two are like distant cousins. And then the host response is primarily what's responsible for the clinical disease. So lots of neutrophil recruitment, lots of local destruction, radicals, proteases. This guy expresses a leukotoxin, so he actually lyses white cells and causes more of a pus explosion. Disgusting. But in a lot of Stockless, similar principles. This one has a couple other associated syndromes with it. So we only touched on this briefly in neuro, but thrombotic meningoencephalitis. This is one that likes to cause embolic lesions, specifically in the brain, and thrombosis of vessels. So this can lead to a pretty severe embolic encephalitis. Astral multocida, one of my personal favorites, mostly because the name multi-side literally means killer of many. Astral, the killer of many. Scary. So this causes respiratory infections in many species, and this is also a big one for septicemia. It's a causative agent of mouth cholera and snuffles, the most common respiratory infection for rabbits. Cat bites, this is the big one. Cat bites that we worry about. That's why they put you on heavy antibiotics. All right, bacterial bronchopneumonia, that's what that looks like. So acutely, it'll be cranioventral. It'll be pretty well demarcated usually. Once it becomes a little more chronic, it can spread, often involving the pleural cavity and mediastinal area, especially the mediastinal lymph nodes and the tracheobronchial lymph nodes. Secondary lesions, so confirmative evidence that this animal's been struggling to breathe. We see contact necrosis in the larynx. So this right here is basically a little scar, and that's from the larynx opening and shutting repeatedly so hard that it's literally smacking into itself and causing ulcers. Chronically, if this is allowed to go on, these can form sequestra. So a sequestrum in any tissue is a necrotic piece of tissue that the body is trying to wall off and exclude. So here's what that looks like in the lung. This big brown chunk is dead. This is totally dead, devitalized lung. And you can see this white outline here. This is the beginning of a fibrous capsule. So it's trying to wall this thing off because it's like, it's too big for me to digest. I can't push it out. I don't know what to do with it. I'll just sweep it under the rug and somebody else can deal with it later. Mycoplasma. So this is a special one in the bronchopneumonia category. I almost like to lump this guy with viruses because it's barely a bacteria. It doesn't even have a cell wall left. So it's resistant to a lot of the common antibiotics, especially the ones that target cell wall, the penicillins. So that it's dominated intracellular, essentially parasite. Remember that mycoplasma is one of the ones that loves cilia. So respiratory, reproductive, inner ear, and it requires special culture media or PCR for detection. So if you send your sample for bacterial culture and don't ask them to culture for mycoplasma, they cannot do it and you will not recover it. It takes at least 2 weeks to grow it, but PCR is easier. Probably not cheaper. Definitely easier. So I lump this guy with the viruses because it's almost like a virus and because it does the same thing. So the main thing that mycoplasma does is predispose you to bacterial infection, lowers your respiratory immunity, primarily by interfering with your cilia. So it gloms onto your cilia epithelium. Your epithelium, as they degenerate, they start to lose their cilia, and then you lose that mucociliary escalator that's pushing pathogens up. So that kind of becomes static, and then things just get free reign to come in. Acutely, this will resemble shipping fever. Co-infections are really common. Those are the bacteria. You can get more multi-systemic disease. So again, it goes to the places we talked about, including the joints. I did look it up. Joints and synovium does have cilia, but they're not modal, so they're not normal. But they do have a form of cilia, so that explains why it goes to the joints. It can also cause infertility, mastitis. The big thing that you're going to see in these infections that should clue you into maybe this is mycoplasma is I've been treating with antibiotics for a long time and it's not working. So it looks bacterial, it's acting bacterial, but it's not responsive to antibiotics. That's all wrong antibiotic. TB, my favorite. So this is kind of a, and I made this last year when I was so officially tuberculosis is only used to refer to disease caused by Mycobacterium tuberculosis, which is an exclusively human pathogen, or Mycobacterium bovis, which is the cow one. So this is technically bovine tuberculosis because it's caused by M. bovis. However, lots of things in vet med are called tuberculosis when they're just caused by a mycobacterium. That's fine. I'll let it go. This is zoonotic. So M. bovis and MTB are actually close relatives or distant relatives, I guess. So MTB is thought to have arisen from M. bovis. So M. bovis has kind of a broader tropism. It hits a lot more animal species, which is a problem for reservoirs because it's maintained in a lot of wildlife in different countries. So it's really difficult to eradicate. And again, it is zoonotic. This will cause TB in human. And past, all right, here's what that looks like. So this is actually really interesting, but in cattle as well as in humans, tuberculosis, most animals that are exposed to the organism on their own. So like 90% of people who are exposed to TB don't go on to develop disease. So high rate of clearance. So most of the cattle that are TB test positive will not have any gross lesions because they've been exposed and they've cleared it. However, we're still going to treat them positive because this is such an important disease economically and for public health that we're going to assume if you're positive, that's it. There's also a low frequency of generalized lesions. So unlike MTB, M. bovis likes to disseminate throughout the body and cause like hepatic, splenic, bone granulomas. In deer, this looks a little different. So it looks a little bit more like caseous lymphadenitis because they get really prominent cervical lymph node involvement, and these can actually drain to the outside and spread bacteria. Deer are disgusting, like so gross. They just carry every nasty thing. So they also shed higher numbers of bacteria, so they're more infectious. So cervids as a wildlife reservoir are very concerning, especially to cow. Here's what it looks like on histopath, but you know that because these are the pictures I used for path. This is the classic granuloma prototype for granulomatous disease. All right, these I'm not even going to talk about. All the info is there. You can read about it. You can see what it looks like. It is reportable. Lungworms. Here they are. There's the info. Don't really have anything else to say about it.